Hello, my name is Priscilla. Can you please give me your initials?
EE.
And what is your primary language?
English.
And what is your date of birth and age?
May 11th, 94, and I'm 28.
And where were you born?
Albuquerque, New Mexico.
And what is your gender?
I'm a male.
What race are you?
White.
And what is your marital status?
I'm married.
What is your ethnic or cultural origin?
Hispanic.
And what is your highest level of completed education?
Bachelor's degree.
And your occupation?
In the military.
And who is your health insurance through?
TRICARE.
And what is your reason for seeking healthcare today?
I'm having indigestion issues.
Can you give me a brief statement describing what that's like?
Yes, in the middle of the night I wake up and I feel bloated and burp and then sometimes have waves of nausea.
And when did this start?
Probably when I was around 15.
And what brings on the indigestion?
Sometimes eating later in the evening, sometimes greasy food, and sometimes there's no pattern at all.
Okay. What makes it better?
Eating earlier in the evening.
Okay. And where is the indigestion occurring?
In my stomach.
Does it radiate to any other areas of your body?
No.
All right. And how long does this usually last?
Anywhere from 15 minutes to 3 hours.
Okay. Anything that helps relieve the indigestion?
Sitting up sometimes I have to walk around, and taking Tums helps too.
All right. And at what time of the day does this usually occur?
Anywhere in the middle of the night.
Okay. And if you had to rate the severity of the discomfort on a scale of 0 to 10, what would you give it?
At its worst, probably an 8.
All right. And then why do you feel like this is happening?
I don't know.
Okay. Have you tried to resolve it on your own in any way?
Yes, I've tried to change my diet habits, eat healthier earlier, and cannot find a pattern that works.
Okay. And do you have any major illnesses, or have you had any?
No.
What about any injuries?
Yes, to my right clavicle.
Okay. Were you hospitalized?
Yes.
Any blood transfusions?
No.
Bone transfusions?
Yes.
And any disabilities?
No.
Any childhood illnesses like measles, mumps, rubella, chickenpox, whooping cough, or strep throat?
Not that I'm aware of.
Okay. Any surgical procedures?
Yes, to my right clavicle.
Okay. And do you know approximately what year?
Say 2015.
All right. And was that an inpatient or outpatient procedure?
Outpatient.
Okay. Are you up to date on all of your immunizations?
Yes.
Did you get your COVID vaccines?
Yes.
And what about the flu shot?
Yes.
Have you had a pneumonia or shingle shot?
Yes.
What about? No, that's it. Okay. Any psychiatric history in your childhood or adult?
No.
Okay. What about any allergies to any medication, food?
Nope.
Okay. Do you take any current medication right now?
Yes.
What do you
It's Prilosec.
Okay. And do you know the dosage and frequency?
It's 20 milligrams twice a day.
Okay. Any other over-the-counter medications that you take?
No.
Okay. And when was your last physical exam?
Last year.
Okay. Any recent blood draws? Prostate exam? Have you ever been tested for tuberculosis?
No.
Okay. When was your last eye exam?
Last year.
And what about dental exam?
Last year as well.
Okay. Any cardiac testing ever?
Nope.
Or respiratory, like a chest x-ray?
No.
Okay, now we're going to talk about your family history. Any significant medical illnesses in your mother or father?
No.
Okay, what about your grandparents?
Prostate cancer on my father's side.
Okay. All right. And any other health conditions or familial conditions that you can think of?
No.
All right. And is that grandfather deceased or living?
Deceased.
And did they die from their cancer?
Yes.
Okay. Are you a U.S. citizen?
Yes.
And do you have any religion?
No.
Okay. And overall, how healthy do you view yourself?
Fairly healthy.
Okay. Any recent appetite changes at all?
Nope.
Are you satisfied with your current weight?
Yes.
Okay. Any recent gain or loss without trying?
No.
All right. Any changes in your food or fluid intake?
Nope.
And how much water would you say you consume a day?
Probably anywhere from 50 to 70 ounces.
Okay. And any cultural restrictions or intolerances?
No.
And how often do you have a bowel movement?
Once a day.
All right. Any urinary issues, urgency, pain, burning, frequency?
Sometimes urgency and frequency. But that's it.
Any incontinence at all?
No.
Right. And where do you live? What kind of city area?
It's probably the suburbs.
And do you live in a home?
Yes.
Okay. Any exposure to environmental toxins that you know of?
No.
All right. Any exposure at work?
No.
All right. Any issues performing activities of daily living like cooking, cleaning, getting dressed, showering?
Nope.
All right. And how are decisions made in your family or in your household?
How are they made?
Yeah. Do you make them?
No discussion with my wife.
Any difficulty with memory recently?
No.
About speech?
Nope.
Any of your senses?
Nope.
And how many hours of sleep are you getting per night?
We're from 7 to 8.
Okay. And do you, how many pills do you use?
How many pills?
Mm-hmm.
Pills for what?
To sleep.
0.
All right. Let's see. And do you do any exercise?
Yes.
What kind and how often?
Primarily aerobic exercise 2 to 3 times a week.
All right. And what are your leisure activities?
Probably video games and riding my bike.
Okay. And have you traveled recently outside of the U.S.?
Nope.
Any social habits like tobacco use, alcohol use, street drugs?
Alcohol.
And how often?
Probably 1 to 2 drinks 3 times a week.
All right. And do you feel safe at home?
Yes.
Any major life changes within the past 2 years?
Moving and started a new job.
All right. And do you feel tense or have any stress?
No.
From that? Okay. How do you relieve stress? What do you do?
Probably road biking and mountain biking.
Okay. Are you sexually active?
Yes.
And what is your gender preference?
Female.
And then has anything changed recently about your sexual health or function?
No.
All right. Now I'm just going to go through each of your body systems and ask you a few questions. Let's see. Any recent weakness, fatigue, or fever?
No.
Within the past few months?
No.
Okay. Any rashes or sores on your skin? Itchiness, dryness, color changes?
Yes. I have eczema on my right knee.
Okay. Any changes in your hair or nails?
No.
All right. Do you experience headaches?
No.
Have you ever had any kind of head injury?
Nope.
Dizziness or vertigo?
Nope.
All right. Any vision changes?
No.
Any eye pain, redness, swelling?
No.
Do you use corrective lenses?
No.
All right. What about hearing changes?
Yes, some hearing loss in my right ear.
Alright, and tinnitus?
Yes.
Do you use a hearing aid?
No.
Okay. Any recent cold or congestion?
Nope.
Right, what about seasonal allergies, hay fever?
No.
Okay. Any bleeding gums, mouth pain, or toothaches?
No.
Okay. Do you wear dentures?
No.
Alright, and do you still have your tonsils?
Yes.
Okay. And any enlarged or tender lymph nodes that you can feel? Any swollen glands anywhere?
Nope.
Alright, any pain or stiffness in your neck or limited motion in your neck?
No.
Alright. Any discomfort in your breast area or nipple discharge? Any kind of surgery? History of any kind of disease?
Nope.
Any recent cough? Difficulty breathing, wheezing?
No.
Any history of any kind of lung issue?
No.
Okay. Any kind of chest pain or discomforts?
No.
Palpitations ever?
Nope.
Alright. Any kind of history of hypertension or a heart murmur?
No.
And has anyone ever told you that you had anemia?
No.
Okay. Alright. So besides the indigestion, do you experience nausea, emesis, difficulty swallowing?
No.
Alright. And do you have a problem with belching or flatulence?
Belching in regards to the indigestion.
Okay. Any change in your bowel habits recently?
No.
Any blood in the stool?
Nope.
Hemorrhoids?
Nope.
Okay. Constipation or diarrhea?
No.
Alright. And then you said you experienced some frequency when urinating. What about painful urination or blood in the urine? Do you urinate during the night?
Yes.
Alright. And then do you experience any dribbling at all?
No.
Okay. Let's see. Do you perform testicular exams on yourself?
No.
Okay. Any tingling or numbness in your extremities, like your hands or legs?
No.
Any leg cramps?
No.
Any varicose veins that you've noticed?
Nope.
Any history of blood clots at all?
No.
Okay. Any recent muscle or joint pain?
Yes.
And where at?
My right knee and right shoulder.
Does it limit your range of motion or movement?
Yes.
Right. Any fainting, history of fainting or seizures at all?
No.
Right. Have you ever had a stroke?
Nope.
Okay. Any tremors or tics that you experience?
Nope.
Right. And any history of mental disorders or hallucinations ever?
No.
Alright. Do you bruise easily or experience any bleeding disorders?
No.
Have you ever had a blood transfusion?
No.
Okay. Any heat or cold intolerances?
Nope.
Excessive sweating?
Nope.
Okay. Any history of diabetes?
Mm-mm.
Thyroid issues?
No.
Have you ever had hormone replacement therapy?
Nope.
And then do you experience nervousness or anxiety?
No.
What about depression?
No.
Okay. Any suicide attempts ever?
No.
So no history of mental illness?
Nope.
Okay. Well, thank you for letting me do my exam.
Yes, thank you.
Oof.
Shabuya woo.